Hi, guys. Welcome to this episode of Head to Total, the podcast that talks about everything that you wanted to know about the medical field, pulling back the curtain. Today's episode is physician assistant Mitch Misiak. Going to be a great conversation because Mitch has got a lot going on. Welcome, Mitch.
Thanks for having me, Colleen.
So, Mitch, in orthopedic urgent care, that's what I hear you're up to these days. But before we jump in, for those that don't know you, and I don't know who doesn't because you're pretty famous, who are you? What do you do?
That's very kind of you. Yeah. So my name is Mitch Misiak. I work for Synergy Health Partners, and currently we're in the process of launching an orthopedic urgent care in Shelby Township. I've been a PA with the group for a little over 5 years now, treating general orthopedics, spine, hand, pain management, that kind of thing. And the practice is moving to be more available to patients and treat more acute injuries. And that's what we're here to talk about today, is this orthopedic urgent care, and kind of help people understand what it is and how we do it and how it can help them.
So, Mitch, I know you're working for an orthopedic urgent care. I have an Ohio public school education. What really is orthopedics? It's a big fancy word. Some people spell it the European way with the A, some people don't. What really is orthopedics? Yeah,
that's a good question and a common question. And I will say, as a disclaimer, one of my best friends lives in Ohio, but I try not to hold it against him. But orthopedics, no matter what state you're in, orthopedics means bone and joint, musculoskeletal system. So at our urgent care, whether you fall and twist your ankle and you're not sure if you broke it or if you sprained it, we're going to see you and be able to tell you. Whether you fell and hurt your wrist, whether you caught a ball and bent the thumb backwards, if you were shoveling the driveway or carrying something heavy in the yard and you pulled a muscle in your back, whether you were walking and your knee popped and it swelled up like crazy and you can barely bend it. Even simple lacerations, if you're playing on the court and you take an elbow to the cheek and you need to get a stitch or two, or you slice the thumb open trying to have an avocado in the morning, anything that involves the muscles, bones, and joints, that's what orthopedics means, and that's what we're able to treat and what we treat all day long.
I think most people, if you ask them to define it, they would definitely say bone, but you're saying joint and tendons and muscles. I think that's where it gets really confusing.
Yeah.
And so it's a torn ligament.
Mm-hmm.
I'm seeing Mitch Misiak. If it's what are the other, walk me through the muscle issues that you guys see.
Yeah, I mean, pulled muscles are really common, especially for like the weekend warrior athlete, which is something that frequents an orthopedic urgent care. So the hamstrings, and the low back are probably the most common types of muscle strains. When you get around the joints, whether it's the elbow, the knee, the shoulder, you're at a higher risk for some type of tendon or cartilage damage. And that's not your simple throw some ice on it and wait some time and it'll get better. That usually requires a little bit further testing and a little bit more thorough of an exam from an orthopedic provider standpoint. So whether it's close to a joint or not, the closer the joint it is, the more serious it could be, basically. And that's something that we're trained at and we see a lot of, and we can kind of delineate whether this is something that's a muscle pull that will get better with some time and rest and ice and anti-inflammatories, or if it's something we need to investigate a little bit more, because some of these injuries around the joints can be surgical or can create bigger problems down the road if they're not treated appropriately.
Is there any words of advice that you could give? Like, you're probably too young to remember, but people used to throw like iced meat on there on a black eye or whatever. When it comes to like hot and cold packs for muscle issues, muscle aches, is there some basic recommendations you can give?
Yeah. So to start, I'm not too young to not appreciate the scene in Sandlot where stepdad threw a big old steak on the kid's eye, and that still works. The only advice I would say is 20 minutes on, 20 minutes off. But whether it's a bag of peas or a nice big ribeye, if you got a black eye, that's a good thing to use. A lot of people will ask, do I use heat or do I use ice? And the general answer is whatever feels better. But to be more specific, if you have an injury, as soon as it happens, it's almost always better to put ice on it, because that's going to help reduce the swelling, reduce the inflammation. So within the first 24, 48 hours of an acute injury, ice is almost always better. Once you get outside of that window, heat or ice, whatever feels better. But generally, as you get further away, you're going to get stiff, you're going to get tight, and heat will help increase blood flow and help kind of loosen up the tissues in the muscle. So you could say ice as soon as it happens, heat after that. You're not going to do any harm either way. So sometimes it's just a matter of what feels better, but general rule of thumb is ice first, heat later. And I'm never going to tell someone to not put a steak on a black eye, but just make sure you clean it and cook it and enjoy it afterwards.
So let's take a step back, because from what I understand, you were a student athlete. You played sports your entire life. What'd you do as a kid other than get in trouble?
Yeah, I got in trouble and I got hurt a lot, and that found me a career in orthopedics. I played hockey my whole life. I played football my whole life. My friends will tell me I was on the team, but I didn't really play, but that's another segment. But I mean, yeah, between sports and basketball and volleyball and all those types of things, I was always an active kid, which found me in more doctor's offices than my mom would like to have been to. But it made me kind of get an understanding for what athletes go through when things don't go well from a health perspective, and made me interested in the orthopedic field. And that's kind of what I've made a career out of now, and I really enjoy doing it. I grew up in Southeast Michigan, went to undergrad at Oakland University, went to grad school at Wayne State. So the Shelby Township, Sterling Heights, kind of Metro Detroit area. So I'm very familiar with that, and that's where I grew up and played all my sports. And that's where we're going to be opening our urgent care. So combination of bad luck and injuries found me in orthopedics, and now I get to be on the other end of it, which has been much better for me.
Well, I gotta say, your teeth are always very nice when I talk to you, Mitch. So
yeah, we won't talk about how many of them are fake from hockey, but the dentist did a good job for me a couple times in the past as well.
So for those, again, that don't know Mitch, he's a physician assistant, which I think, Mitch, a lot of people are confused by. Can you give us a breakdown of what really is a physician assistant?
Sure. So in our practice, specifically physician assistants, we work alongside our surgeons. A physician assistant had a 4-year undergrad degree and then went into a master's program, which can kind of be described as a mini med school. There's no residency, there's no fellowships like there are in medical school, but it's a 2-year master's program where they kind of try to condense the biggest parts of medical school and train us through the medical model. We're considered a mid-level provider, depending on what type of rhetoric you want to use. Nurse practitioners are on a similar level. But in orthopedics specifically, we get to work alongside the surgeons in clinic, as well as in the hospital setting, as well as in the operating room. So as far as diagnosing, treating, reading x-rays, prescribing medications, making surgical decisions, that's something that we're able to do side by side with our surgeons every day. And when you're in a specialty practice like ours, where it's just orthopedics, it's something that becomes repetitive and allows you to be confident in the decisions you're making and ultimately help your patients out because you're an expert in your field. So that's a good thing about being in a specialty practice like this.
Mm-hmm. Mm-hmm. So you treat all kinds of orthopedic injuries?
All kinds, every kind.
Head to toe.
Head to toe. Head to
Head
total.
to total.
Head to total.
So nice way to do that, Mitch. Way to do that. What's all right? So let's talk about the orthopedic urgent care, because I know this is the second one you guys have opened up.
Correct.
Right.
Yeah.
And it's what it's all ages who fall and hurt themselves.
Definitely. So yeah, orthopedic urgent care is different from your general urgent care because we're strictly focused on orthopedic injuries or musculoskeletal injuries. Basically, any injury to a body part, whether it be from the finger to the toe to the back to any joint or limb, that's what we treat and what we're good at and what we know. Compared to a general urgent care where they treat those things as well, but you're also in a waiting room full of people with coughs and chest pains and stuffy noses and head traumas and things that are on a different caliber and a kind of different side of medicine, which can increase your wait times, can kind of bog down those systems. So to be able to offer a strictly orthopedic urgent care for, Jimmy that fell off the slide and hurt his wrist, or grandma that kind of tripped going down the stairs and needs to get an x-ray really quick. Those are the types of injuries that we can see on the spot, and that's what we focus our care around.
So the one in the urgent care in Shelby Township, I hear it's located within a sports complex. Can you talk about that?
Yeah, so in Shelby Township, we're going to be inside Greg Grants Sportsplex, which was formerly Joe Dumars Fieldhouse. They offer a lot of basketball, a lot of baseball. They've got big field turf area, big volleyball community there, basically all the sports you can think of. I happened to grow up in that facility when it was Joe Dumars Fieldhouse, and worked through college as a ref and coached the youth hockey program and played there. So I know the facility and the area really well, and I think it's just a perfect spot to have an orthopedic urgent care so that we can be on site and present for athletes shall they need us, but also kind of in the heart of that community at the Sterling Heights area for anybody not athlete injured in the facility, but somebody injured that just knows about us and needs to be seen quickly. We'll be there 7 days a week from 8 to 8 to be able to treat them. So trying to be more available to the patients that need us and in a convenient location, whether you're an athlete playing in the facility or you're just average Joe that needs to be seen in a hurry, we're going to be there.
Did you take more shots as a ref or when you played hockey?
Far more as a ref, because they don't like it when you retaliate as a ref, but when you're playing, you get to kind of go back and forth with them. But my boss really didn't like it when I retaliated as a ref. So that allowed me to, I'd like to think, develop a calm demeanor in the face of trauma, which is good for this career as well.
What's the most challenging cases you're seeing at the orthopedic urgent cares?
Yeah, I mean, challenging is subjective, right? When all you do is treat injuries and treat fractures all day long, the repetition is what builds your strength and your confidence. The challenges come, whether you're seeing a really young patient or perhaps a really elderly patient, and maybe they don't have the ability to communicate what their injury is or where the pain is coming from or how it happened. Those are things that you kind of learn how to take cues from the physical exam or from the body language. So the actual diagnosis and the injury itself isn't necessarily the hardest part. It's a matter of being able to communicate with your patient to know what's bothering them, how did it happen, what mechanism caused the injury, because those things help kind of guide and tailor our decision-making process. Those are some things that you'll learn along the way.
And this weekend, I'll trip and fall over something in my inappropriate shoes.
Good-looking shoes come at a cost, and we'll be here for you. I mean, not everyone can just be all function all the time. We got to have those with style, and we appreciate that.
Yeah, I had a podcast with Dr. Klein, the podiatrist, who talked to me about my inappropriate shoes. But Dr. Klein aside, I'm still going to wear them.
Of course.
So, yeah, of course. So when I trip and fall this weekend in my inappropriate shoes, because I may or may not have had an adult beverage or two,
sure.
And I come see you, talk to me about when I walk in. I'm going to be waiting. Am I going to have x-rays, or is it just, it's a case by case basis? But the average patient that comes to see you, Mitch, in the urgent care, what am I expecting?
Certainly. So at our facilities, we make a promise to patients that you're going to be seen by an orthopedic specialist within 20 minutes of arrival. We've done everything we can to streamline our check-in process and our ability to obtain a important and focused history so that we can get to treating you right away. So you're not going to be in a big urgent care ER type of waiting room with 50 people and put on a gurney down the hall or anything like that. We're going to get you in and see you. Yeah, I would say, upwards of 80% of our patients end up getting an x-ray because these are usually acute injuries. And if we're worried about any bony injury of any type, it's just wise and it's best for the patient to get an x-ray. There's certain circumstances where it's not indicated. But you're going to come in, we're going to streamline the check-in process. Likely that you get an x-ray depending on the injury based on what the provider thinks. And the most important thing for us and for our patients is that you get a diagnosis, you know what you can and can't do when you leave the office, and you know who you're following up with and when. A lot of times people go to an urgent care and they're like, yeah, I got some antibiotics. I think I'll be okay. And they leave with not a whole lot of direction. And in orthopedics, it's important to know, hey, is this broke? Is it not? Can I walk on it? Can I lift with it? When do I need to see the doc again? Do I need surgery? So we make it very clear when you leave there that you're comfortable and confident with what the next steps are.
Awesome. I think a lot of people too, when they think orthopedic urgent care, if they even understand the difference, and you've explained it well, so thank you. But it's not just broken ankles, broken legs, broken arms. I know somebody who got their finger caught in a garage door and they showed up to the orthopedic urgent care and they had an experience and that was really positive. So it's everything from head to total.
Absolutely.
So Mitch, what's great is at the other facility that you were mentioning in Shelby Township, there's also a physical therapy there. So can you talk to us a little bit about what it's like to transition from, I come to see you in the orthopedic urgent care. It is a break. It's a break in my wrist.
Mm-hmm.
And then I then can go to you guys for physical therapy as well.
Yeah, absolutely. So, physical therapy is a large part of orthopedics. So we try to incorporate our staff and our ability to get patients into therapy as quickly as possible. So, specifically at this urgent care in Shelby Township, we have therapy on site with all the bells and whistles you could expect from a state-of-the-art physical therapy facility, as far as machines and field turf track, things like that. Because some things require surgery to get better properly, and other things, there's a lot of other steps you can take and things that are more appropriate to treat it completely or to at least try first. So whether we're talking about bracing or therapy or injections or simply time and observation, therapies plays a big role in it. So we have the ability, if I see someone on site and they have they were cutting the grass and they lift a heavy bag and they've got a lumbar sprain or, a pulled muscle in their back. I'll be able to set them up with a therapist on site while they're there to get treatment started right away, as opposed to, in the times before orthopedic urgent care, you pull a muscle, you wait 3 days to see your primary. Your primary gives you a referral to your orthopod. You wait 2 weeks to go see him, and then all of a sudden it's a month after your injury and you haven't had any treatment yet. Now we could take care of you and get you onto that path within the same day. Because that's what gets you better faster, is getting the right diagnosis and the right treatment as fast as possible.
How many times a day do people walk up to you when they know you're a physician assistant and say, "Oh, my back hurts. What do I do?" Do you ever get tired of that, Mitch?
I don't get
random people asking you, "Hey, this really hurts. Can you look at it?"
Yeah, between walking up to me or calls and texts, it happens daily.
Yeah.
That's definitely not an understatement. I don't mind it. You don't go into this field unless you want to help people. And you have someone texts me or calls me with chest pain, I say, go to the ER. That's not what I do. But, if they have an orthopedic injury, that is what I do. And I'm happy to help them. And now we can formally, help these people if they need more than just me trying to diagnose something over a text message or while I'm walking to my car in the parking lot. We can, say, hey, listen, come in, let's get an x-ray. Let's treat this the right way. But and that's part of being a physician assistant, right? There's tiers in medicine, and maybe some people know a surgeon but aren't comfortable talking to them because they don't want to bug them. But the reason PAs go into the field that they do is because they want to spend time with patients and they want to make people better. And we want to be able to give our patients time when we have it. So I'm always happy to do that whenever possible.
There's going to be a lot of pickup softball games happening this weekend here in Southeast Michigan. There's going to be a lot of kickball, baseball, soccer.
Yeah. Weekend warrior time.
Yeah, which is why this is a great conversation to have right now, because a lot of us aren't used to doing that every day. We're not finely tuned athletes, Mitch. Not
all of us can be, Colleen. That's okay.
No. What tips, tricks, so that we don't have to see you this weekend, no offense, what tips and tricks do you have for those of us that aren't always playing sports? We're just doing a little bit of fun this weekend. What should we do to help warm up and to stay safe?
I think you just mentioned it there at the end. It's preparation, it's warm up. People have time and they want to go have fun, and we want to encourage anybody to get outside and be active. The more active you are, the more you're moving the body, the less likely you are to have an injury. But if you go from sitting on the couch 60 hours a week to playing 6 softball games in a weekend, chances of you spraining something or pulling something are pretty high. It's always good to stretch. It's always good to hydrate. It's always good to warm up and take a jog around the field or the court or whatever it may be before you start. That's something, I haven't done this in 4 years, but I'll be fine. Those are the patients that usually end up in our office. And we'd love to see you when that happens, but spending some time ahead of time to make sure you're properly hydrated, especially if it's going to be a hot weekend or just through the summer in general, and stretching so your body is ready, so the muscles are loose and limber. That's going to avoid those, a little hamstring pull can linger for a month or two, and it becomes a really frustrating type of injury that could be avoided if you put, 20 minutes into stretching ahead of time before you have your family softball game where you got to beat Uncle Joe, but I should have done a couple toe touches before I got out there, kind of thing.
Mm-hmm. It's funny because I was listening to, and I believe he's working with you, Dr. Jeff Mendelson did a presentation this week at an expo that I attended. And the very words that he used was, motion is lotion. You should be using your joints as much as possible. Even if you've had an injury in the past, the best thing you can do is get up, move around, stretch it out before you try to do something stupid like play softball for the first time in 20 years.
So I want to make one comment on that because I mean, it's Dr. Mendelsohn. How do you not watch his speech to Schoolcraft College? So I tuned into it, and he said, somewhere in my practice, I heard this line, motion is lotion. And that is my line that I got from an occupational therapy buddy of mine that was in PA school with me 5 years ago. He said that line to me, and I like it, and I say it in practice. And I texted Dr. Mendelsohn. I told him I'd send him an invoice for using my line. He hasn't gotten back to me yet, but it rings true. Whether you've been in orthopedics for 30 years or for 1 year, yeah, motion is lotion. If you're using the body, keeping the joints moving, keeping the muscles loose and limber, chances of recovering quicker or preventing an injury in the first place go down dramatically.
So maybe in our next podcast, we talk about trademarking key medical phrases.
Oh yeah, that's a thing. That's a thing. We got to be careful with these guys.
Apparently. So if you can't have Mitch Misiak on your softball team this weekend, you can always see him at the Orthopedic Urgent Care.
You can see him at the Urgent Care.
I will be there.
I will say you probably don't want me on your softball team. I played a lot of sports. I played 1 season of baseball. I got on base every game, but only because I leaned in and got hit by the pitch because I couldn't hit the ball. So I'm like, all right, I'm going to take one in the shoulder for the team. But I got on base, so I did my job. So if you need that guy, give me a call.
That's probably better than what I can do. As long as you don't knock over my beer as I play third base, I'm good.
We talked about it. Hydration is key. We need you out there as well.
It's true. Mitch, can't thank you enough. Anything you want to close with? Talk to us about, I know you have another urgent care in Livonia, Michigan, too.
Yeah. As a whole, the practice is trying to be available to both sides of town. So we have a pretty big standing group and office in Livonia across from St. Mary's Hospital, and our orthopedic urgent care runs out of our office there. So we've been open since March and been doing great. Again, we're open 7 days a week from 8 to 8. You are going to see an orthopedic PA within 20 minutes of arrival. We've been able to stick to our goals and our promise on that. And it's 7 days a week. We're closed on the major holidays. We're available on both sides of town so that, whether you're on the east side or the west side where our established patients are, or whether you're new patients that needs to see someone for an orthopedic injury on the spot, and you don't have to go to a general urgent care or an emergency room, we're going to be available for you. And that's what we're trying to offer to our patients so that we can help them get better quicker.
Yeah, that's cool. Because then I could get hurt Saturday night in Shelby Township. Sunday, I get hurt in Livonia, and it's a win-win for me.
And you're going to have that high-level orthopedic care no matter which office you see us at.
I'll be well hydrated when I come into the orthopedic urgent care. Mitch, can't thank you enough. Great to spend the time with you today. I appreciate it. I know it's going to be a busy weekend for you. I know you're going to have a lot going on, but I really appreciate the tips and tricks. Really appreciate the knowledge of the fact that you guys are there for us 8 to 8, 7 days a week when I fall and break anything. So thanks so much for the time.
Thanks for having me, Colleen. We hope you have a healthy and injury-free weekend and weeks to come, despite how good-looking your shoes are. But if something does happen, we're happy to take care of you.
Appreciate it, Mitch. Thanks.
Thank you.